Hello everyone. In this video we will study about Emesis and its medications. So let's start. So first of all we will study what is vomiting. Vomiting is just the ejection of stomach contents like food and water from the mouth, or we can say it's the backflow of the stomach contents. And how the vomiting is initiated? Vomiting is initiated basically by the stimulation of a center called chemoreceptor trigger zone, or for short we can say CTZ center, which is present in the medulla oblongata, outside of the blood-brain barrier. And it can also be initiated by a vomiting reflex in the vomiting center, or we can say VC. Now we will study the types of vomiting. Basically, there are 6 types of vomiting. First type of vomiting is vomiting of pregnancy. Vomiting of pregnancy is occurred due to the placental hormones like progesterone and HCG, which is human chorionic gonadotropin, and this can initiate the CTZ center in the brain, and when it is initiated, it can start vomiting reflex. Our next type is vomiting due to uremia. Uremia is the increased level of urea in the blood. An increased level of urea can also initiate CTZ center, and it can start vomiting reflex. Vomiting due to disease state. Vomiting can also occur due to disease state like pyloric stenosis. Pyloric stenosis is the constriction of pyloric region of the stomach. When the pyloric region of stomach is constricted, it can lead to delay of food passage from stomach into the intestine, and this delaying can cause stretching of mucosal membrane, and when the mucosal membrane will stretched, it can activate or stimulate these sensory nerves, which can start vomiting reflex. So the next type is post-operative vomiting. As the name indicating, post-operative vomiting, or after surgery vomiting. And this type of vomiting can occur due to general anesthetics, like for example we have ether, which is a very irritating general anesthetic. Almost all the general anesthetics are very irritating, and they can cause vomiting reflux, which can start vomiting. The next type of vomiting is vomiting due to radiation sickness. Radiations can also activate CTZ center and can cause vomiting. And the last type of vomiting is vomiting due to motion sickness. Sometimes due to over noise, there will be overstimulation of middle ear. Overstimulation of middle ear will cause the sensory nerves to stimulate the vomiting center, and vomiting center will initiate vomiting center VC will send message to GIT and induce vomiting. Now moving forward, anti-emetic drugs. The drug or an agent that can stop or counteract the vomiting is called anti-emetic drugs. And now when we can classify all the anti-emetic drugs, and there are basically 6 classes of anti-emetic drugs. The first class is the phenothiazines. The second class is 5-HT3 serotonin receptor antagonist. Then we have substituted benzamides. Then fourth class is Butyrophenones. Fifth class is the benzodiazepines. Number 6 we have corticosteroids, and at the end we have substance P or neurokinin 1 receptor blockers. They are also called NK1. Okay, let's move forward to our very first class of anti-emetic drugs, which is phenothiazines. Phenothiazines are basically dopamine receptor antagonists. They block dopamine receptors present in the CTZ, and in this way they block the vomiting reflex and they stop the vomit. And phenothiazines are only effective against low or moderate emetogenic chemotherapeutic agents, like for example fluorouracil is an example of moderate emetogenic chemotherapeutic agent, and phenothiazines are very effective against these chemotherapeutic agents, but they are not very much effective against the strong chemotherapeutic agents, like for example we have dactinomycin, which is a very strong chemotherapeutic agent. And the drug which include in the phenothiazine is prochlorperazine. It's the only drug. Now we'll study very common side effects of phenothiazines or prochlorperazines, which include constipation, dryness of mouth, dizziness, trembling of hands and fingers, and problems with the memory. Sometimes temporary memory loss will occur. Okay, let's move forward to our second class of anti-emetic drugs, which is 583 receptor blockers. 583 receptor blockers are very effective against chemotherapy-induced vomiting, means they are effective against the vomiting that is introduced by anti-cancerous agents or chemotherapeutic agents like we have dactinomycin. Now, here we have mode of action of 583 receptor blockers. Chemotherapeutic a drug, when we take chemotherapeutic drugs, and they are so much dangerous that they can even destroy the hair follicles, and when they rupture the membrane, the chromaffin cells secrete serotonin 5-hydroxytryptamine. 5-hydroxytryptamine, or also called 5-HT. Serotonin then binds with the 5-HT3 receptors periphery and centrally. Both 5-HT3 receptors are present at three sites in our body. One at mainly one periphery at vagal nerve, and centrally it is present at two places at CTZ and at VC both. Vomiting reflex will be there and vomiting occur. This was a normal path when we take chemotherapeutic drug. And when we take 583 receptor blocker, these drugs just block this receptor, means 583 receptor blockers, and they stop vomiting reflex, because there will be no binding of serotonin with this receptor and there will be no vomiting reflex. Here we have including drugs of 583 receptor, which is dolacetrone, granisetron, ondansetron, which is very important 583 receptor antagonist, and polonosetron. Now moving forward to the side effects of 583 receptor antagonists. The dose should be adjusted in hepatic patients. It means the patients with the hepatic insufficiency should take this drug with very care, because metabolism of these drugs mainly occur within the liver. Metabolism mainly occur in the liver, so that the patients with the hepatic insufficiency should take this drug with very careful. Headache, which is a very important and very common 583 receptor blockers side effect. It also causes ECG changes. It can cause QT, increase QT interval, and it should use with be very caution. Okay, here we have third class of anti-emetic drugs, which is substituted benzamides. Substituted benzamides are also D2 receptor blockers at CTZ. D2 means dopamine 2 receptor blockers. They block dopamine receptors at CTZ and stop the stimulation of CTZ, chemoreceptor trigger zone. In this way, there will be no vomiting reflex and there will be no vomiting. It includes only one drug, which is metoclopramide. And metoclopramide also act as prokinetic drug, which is a very important function, and it enhances the gastrointestinal motility. Means it, when it increases the gastrointestinal motility, it will increase the passage of food from stomach to the intestine. In this way, it also works in preventing vomiting. Now, side effects of metoclopramide including sedation and diarrhea. Now, let's move forward to the fourth class of anti-emetic drugs, which is butyrophenones. Butyrophenones are also D2 receptor blockers. They block dopamine receptor 2 at chemoreceptor trigger zone, and they are very effective anti-emetics. And they have only two drugs. One is droperidol and the second one is haloperidol. Droperidol is of more importance as compared to haloperidol. Common side effects of the butyrophenones including sedation, headache, dizziness, and diarrhea can be due. Here we have fifth class of anti-emetic drugs, which is benzodiazepines. Benzodiazepines are basically GABA effect enhances. They enhance the effect of GABA at GABA A receptors. GABA. What is GABA? GABA is an inhibitory neurotransmitter, gamma aminobutyric acid, known as GABA. And GABA causes sedation and anxiolytic effect, and it also causes amnesia. This effect makes benzodiazepines, the sedative effect mainly makes benzodiazepines useful antiemetics, including the drugs is lorazepam and alprazolam. Here are the side effects of benzodiazepines. It can cause amnesia, mean memory loss, and it also causes sedation. Sixth class of antiemetic drugs is corticosteroids. Their antiemetic mode of action is still not known, but they cause inhibition of prostaglandin, which has emetic function, and also secrete endorphins that cause elevation in the mood. And these two main functions make corticosteroid an antiemetic drug. And this class mostly used in combination with other drugs. It is not a very important drug, not a very important class of drugs. The side effects of corticosteroids including insomnia, and they cause hyperglycemia in the patients with the diabetes mellitus, because as we know corticosteroids increase the formation of glucose. So in the patients of the diabetes mellitus it can cause hyperglycemia, increase glucose, blood glucose. Including drugs, corticosteroids include two drugs, dexamethasone, and the other one is the methylprednisolone. And now we have the last class of antiemetic drugs, which is substance P or neurokinin 1 receptor blockers. They block neurokinin 1 receptor for the substance P. What is the substance P? Substance P is a neurotransmitter stored in the vesicles, released from the sensory nerve, and it is also released from the macrophages and eosinophils in response to the various stimuli such as leukotrienes, histamines, and prostaglandins. Substance P is involved in the transmission of stimuli like pain or emetic reflex. That's how it's causes vomiting. And here we have the mode of actions of these drugs. These drugs block the neurokinin receptors, and as they block this receptor there will be no binding of substance P, and there will be no transmission of vomiting reflex, and there will be no vomiting. It includes only one drug, which is Aprepitant, and its metabolism occurs through enzyme cytochrome 453A4. Now, moving forward towards the side effects of aprepitant, which is constipation and fatigue. Here, the best combination for vomiting, ondansetron and dexamethasone. These two drugs show 91% of response as antiemetics after taking chemotherapeutic drugs in first 24 hours. This is a very important drug. This combination is really very important. And at the end, thank you for watching this video.